Well, welcome to our webinar today. I'm going to start by acknowledging that I am here in Nova Scotia, and it's called Mi'kma'ki, and our community center is located on the ancestral and unceded territory of the Mi'kmaq people, and that we're all treaty people. I'm going to have the pleasure now of introducing my colleagues here on this project. I'm going to do a little bit of housekeeping first, though. So welcome. We're glad that you could join us. And for housekeeping items, we'll be sending you a copy of today's presentation. We'll have it in English and in French. And the links are in the presentation to all the different resources that we accessed. And so you'll be able to access them there. Feel free to take breaks if you need to. The session's 90 minutes long, so an hour and a half. And we know that gender-based violence can be a difficult topic, so we all need to be mindful of self-care. We have French interpretation for this session today, so if you needed to hear the session, if you'd like to hear the session in French, you should have received the number, the call number, but it's 1-866-229-4144. And the passcode is 8335788 hashtag. So we may need to slow down a little bit from time to time because we do have simultaneous interpretation of this session today. So in our partnership group that we have here today, we're working together on a cross-Canada project to raise awareness about gender-based violence and to develop tools and trainings and resources about the topic. Our focus is on organizations that work with newcomers, immigrants, and refugees, especially in the settlement and anti-violence sectors. So now I'm going to introduce our panelists today, the co-presenters. Erin is the Executive Director of the Ending Violence Association of Canada, a national organization based in Ottawa that is focused on addressing and responding to gender-based violence. Before taking on her present role, Erin was a senior researcher for the National Inquiry into Missing and Murdered Indigenous Women and Girls. She's also worked for a number of years in community-based sexual assault response in Fredericton, New Brunswick. So I'd like to introduce now Margarita. Margarita is a qualitative researcher and social worker and is currently the senior coordinator for the Initiative to End Gender-Based Violence at the Ontario Council of Agencies Serving Immigrants, OCASI. She coordinates a collaborative and national project focused on building leadership capacity to address GBV against non-status, refugee, and immigrant women. The primary objective of this project, or the objectives of this project, are to strengthen the leadership and advocacy capacity of NSRI women and frontline workers, community advocates, and stakeholders through the formation of communities and networks to shape and inform policies and services addressing GBV across Canada. Thank you, Margarita. Lauren is also with us. She's a registered social worker who's been working with individuals and families facing a variety of challenges since 2011. She uses a multi-modal and strengths-based approach to empower clients towards health and well-being. Lauren has extensive experience in the field of crisis intervention and is currently managing the Women's Awakening program at the Elmwood Community Resource Center in Winnipeg. And I'm Catherine. I work at YMCA Immigrant Services in Nova Scotia, and I have worked here for 20 years and also led a lot of programs for immigrant children and youth, particularly priority youth. And I'm currently leading our local GBV prevention programming and working on this project with this team. So I'd like to also introduce our moderator today. Selena Abji is a sociologist, a sociologist, a research consultant, specializing in grant writing, needs assessments, and evaluation for feminist and immigrant serving organizations. For the past 8 years, Selena participated as an organizing member of the Rights of Non-Status Women's Network, a grassroots advocacy group in Toronto. Selena has led the needs assessment of this national GBV settlement project and is currently involved in research consultation for other projects about gender-based violence. So welcome, everyone. So now I'm going to talk a little bit about our partnership and about us. So we came together in April 2019 to begin this work, and since then have discussed many different issues, terms, concepts, and approaches, and as a group felt it was really important to acknowledge in our project that GBV affects all communities, that GBV is a broad term that includes different patterns of violence, including sexual violence, that newcomers, immigrants, and refugees are underserved when it comes to awareness and supports about GBV. And it's also important to note when we're working with newcomers that this group have highly diverse and intersectional experiences. And while they may share some needs around information orientation and being welcome to their new homes, it's a very diverse population. So we need to learn more about different cultural backgrounds. So this is our national webinar series. And we presented 2 webinars in May, the foundations of gender-based violence. We were talking a lot about COVID-19 and the new reality of that, and safety planning and risk assessment in May. So you can access those first 2 presentations if you weren't a participant at that time on our website. We'll be launching a website in the next few weeks, so you'll be able to access it there as well as the information we collected in our e-scan, and we'll send an announcement to everyone who registered. So webinar 1 was a foundational webinar that introduced workers to GBV and the impacts for newcomers, immigrants, and refugees during COVID-19. And we introduced 5 common approaches from our project. So intersectionality, anti-oppression, anti-racism, trauma and violence-informed approaches, and using cultural humility and safety. And at that time, some participants expressed interest in having more information about how to apply these approaches. So we're going into that a bit today. So our fall series is focused on allyship, and the dates here are the sessions. October 7th is our first here today. So we're focusing on allyship as a core skill set for service providers who want to build their capacity to support GBV survivors and to coordinate with others across sectors. So I mentioned that our website will be launched soon, but we also have a group on SettleNet, which is a national website that OCASI manages. So I'll explain a little bit more about that at the end. So now I'd like to welcome our moderator, Selena, to go over the objectives of today.
Fantastic. Thank you, Catherine. And our panelists, feel free to turn off your videos if you like, and we'll call you back when it's your turn. So thank you. I'm so delighted to be here today. Thank you, everyone, for joining us middle of the week. Hope you're all keeping well. Just before we go into today's learning objectives, I just want to note here that this is really meant to be an introductory webinar where we'll be providing a lot of foundational information to get you started in this area. So we really invite you to just take it all in and know that you will have access to the slides and the recording in case you want to circle back to this information in the coming weeks and months as an ongoing reference point. Okay, so what are our objectives today? So by the end of today's webinar, you, our participants, will be able to explain what allyship is and why it's important when responding to gender-based violence in particular. You'll also be able to identify key considerations when practicing allyship with newcomer, immigrant, and refugee communities using anti-oppressive and culturally safe approaches. And now these are approaches that we've used in previous webinars, which will apply today to the skill set of allyship. Beyond general approaches, you'll also leave today's webinar with some practical strategies that you'll be able to apply in your everyday work life and hopefully in life in general, including allyship in the current context, which, as we know, includes COVID-19 and a lot of different things that people are dealing with right now. And then finally, you'll also know how to find additional training and resources for frontline workers on this issue. And as I mentioned, today's webinar is foundational, but there are other resources that you might want to explore following today's introduction to the topic. So we'll leave you with some useful links in that regard. Great, next slide. Okay, so we've divided today's session into 3 parts with some short breaks in between. We're going to start with some key definitions that we're using and talk about how we're bringing these ideas together when discussing allyship, gender-based violence, newcomers and refugees, all in the context of COVID-19. So there's a lot of layers to the issue that we're talking about today. In part 2, we'll dig a little deeper and highlight for you the 5 key approaches that we're centering in this project, including anti-oppression, trauma-informed, and so on. In part 3, we'll offer you almost like a brainstorm of practical tips and strategies that you can apply in very concrete ways. So today's not just about conceptual approaches, but also practical strategies you might want to think about. And we'll close with some additional resources and how you can get involved. And as we go through, if you have questions or comments, you can put them in the questions or in the chat box. And we'll do our best to respond either during the webinar, or we'll take a collection for those that we don't get to, and we'll send out a follow-up. We'll also be asking for feedback more formally following the webinar, so look out for that email. We'd love if you could share what you found useful about today's webinar and what else you'd like to see in future training and support. Great, so let's turn now to part 1. So we're going to start by defining 3 key concepts that we're using in this webinar. So the first is allyship, of course. We're also going to talk a little bit about how we're defining that category of newcomers, immigrants, and refugees that we're using in this project. And then thirdly, we will define gender-based violence and how we're using that in the project. And then we're going to bring all of those concepts together and talk about the focus of today's webinar. And here we're going to add a 4th layer, which is the context of COVID-19 and other related crises that really make this work more important than ever. So let's start. I'll turn it over to Lauren, if you could join us, who's going to start with the first definition.
Wonderful, thank you, Selena. So when we talk about what is an ally, there are many different definitions and understandings on what it means to be an ally. For this presentation, we are using the definition developed by Ann Bishop, which defines an ally as someone who recognizes the unearned privilege they receive from society's patterns of injustice and takes responsibility for changing these patterns. Being an ally does not necessarily mean that you fully understand or fully have the same experience of oppression as someone else. It means that you're taking on the struggle as your own and recognizing your role in the continuing of that oppression. So we can move to the next slide. So becoming an ally is a lifelong process. This is, as Selena had mentioned, this is fundamental, but it's also one of the things that no one ever really fully achieves that level of being an ally, because it's always about continuous growth and continuous change and continuous self-monitoring. So it's not one of those things where after the end of our hour and a half together, you're going to be able to be an ally or call yourself an ally. It takes a lot of work throughout your life. It can often feel very uncomfortable because a lot of being an ally is recognizing our own role in continuing oppression and how we may benefit from oppression that harms other people at times, and so that can feel really uncomfortable, especially since that's never our goal. Usually it's systemic and it's ingrained within our society, but that does exist. However, if you're able to sit through that uncomfortability, it can be a joyful and really life-affirming process. So we'll move to the next slide.
So thanks, Lauren, for explaining allyship, the intro to that there. The other concept that or term that we're defining in this part 1 is about immigration and key terms in that regard. So those of you who are familiar with how immigration works in Canada will already be familiar, I think, with this definition, but so that we all have a common base of knowledge here. So a permanent resident is a person who's granted the right to live permanently in Canada, and this can be a person who comes to Canada as an immigrant or as a refugee. And the difference between an immigrant and a refugee is that a refugee is forced to flee for their lives, and an immigrant usually chooses to move to another country. And a person without status is someone who can be vulnerable based on their status. And so we want to make sure that people without status don't fall between the cracks of the system. So there's more information on definitions at the Canadian Council for Refugees. And understanding power and privilege is something that is like a lifelong process, as we said. But it doesn't mean that a person who has privilege hasn't experienced suffering. It does mean that a person would have an unearned benefit or advantage received in society through our identity. So examples of types of identity that can give an individual privilege include race, gender, sexual orientation, religion, socioeconomic status, country of origin, language, and/or ability. We can think of our own identity and compare it to the most powerful people in society. Now, you may be familiar with an activity called the Power Flower that encourages us to identify where we have privilege and where we may not. So offering information orientation with newcomers puts us in the position of assisting individuals who are in need of resources and who are sometimes facing challenges. In this case, issues of gender-based violence. Service providers can be gatekeepers to resources that the individual or family needs, and they're often unable to access without our assistance. So shifting this power imbalance is something that we can work on in our interactions, in our practice. Thinking about privilege and challenging it is an ongoing process. So Lauren's going to explain a bit more about privilege and share some resources from her community center.
Thanks, Catherine. So I want to start with sort of a conversation around some of the common barriers that people will face when it comes to being an effective ally. The top one is around becoming a rescuer or entering into that rescuer role. Many of us have entered into this field with the desire to help people, and as a result, it can be very easy to take on that role as the rescuer. Since the 19th century, Western society has been flooded with images of that noble, humble white savior. This term typically portrays a white person who turns away from their racist community with the aim of helping or saving a person who is struggling or experiencing oppression. You can think of tons of movies that have focused around this, things like The Help, The Blind Side, those types of things. The trick is what happens when we enter into the role of the rescuer is we're implying that these individuals are less than and need us. And as a result, we end up disempowering people. One story that I always share when I talk about being the rescuer is actually a former coworker of mine. He used to work at a casino where he had quite a number of Indigenous people working for him. And there was one dealer in particular that was this Indigenous guy. And some customers came in and just started giving this Indigenous guy a hard time. And so my coworker decided to go over there and tell them off and tell them that's not okay and not acceptable and they needed to leave. And he was feeling very proud of this moment that he stepped in and felt like he was being a real ally. And then what happened at that point was the Indigenous guy looked at him and said, "I can stick up for myself, you know." So what we end up doing is we end up taking power away from people when we enter into that role. So that's really one of the most common barriers that people face and that people get trapped in. Many would-be allies also fear making mistakes that could have them labeled as racist, sexist, transphobic, homophobic, anything of that nature. But as an ally, you're also affected by a system of oppression. And this means that as an ally, there is much that you need to unlearn and relearn, and mistakes are expected. You're going to make mistakes. And it's important to acknowledge that the immigration system itself is based on a process that encourages and perpetuates colonization. So if you refuse to acknowledge that your words and actions are inherently shaped and influenced by this system of oppression, then you're setting yourself up to fail. This does not necessarily mean that you're doing bad work, but to recognize that mistakes will happen. the best example that I can give of this is I was on my way to meet an Indigenous elder, and I had some questions for her that I was really excited about asking her and getting to meet her. So she works as president at Blue Coast College, Dr. Leona Makokis. And Blue Coast College used to be a residential school in Alberta that was taken over again by the community. And so I was on my way to meet her, so I got myself all dressed up, put on my heels, put on my fancy dress, and got myself looking professional to go in and ask her these questions. And I'm walking through the residential school, and my stepfather, who was introducing me at the time, did sort of a, "Psst, what are you wearing?" And I said, "What?" He said, "Your shoes." I said, "What's wrong? What?" Because the nuns wore heels. So that's something that I didn't even realize, that for me, what I thought I was doing was being respectful by getting myself dressed up and wearing that, but that was from a Western point of view. I didn't realize that my actions could be triggering individuals. And so to be very aware that those sort of things can sneak up on us, and that's okay. Again, it doesn't mean that you're doing bad work, but to accept that that will happen, and to be willing to own it and apologize for it, and work through that. The other challenge that lots of people will face is around sort of a belief that you're not an oppressor, or feeling defensive or wounded if people question those actions. Again, mistakes happen, be prepared for it. We don't get to decide what the intention of our actions were. Individuals get to decide what the intention meant for them, and we have to own that. So how can I be an ally without becoming sort of this rescuer? My top thing is to listen and to ask people what they need from you. So witnessing experiences of oppression, like my coworker did, instead of jumping in and saying, "Let me fix this for you," it's about coming in and saying, "What do you need from me? Do you need me to talk to these guys? What do you need?" And being prepared if the answer is no. No, I don't want your help. And we have to be okay with stepping back and seeing that. Be aware and learn about the immigration system. Learn about the cultures of the communities that you serve. Put yourself out there, ask those questions, and recognize when someone else is a better fit to do work that you might not be the best fit for. So we have a woman here at our organization who is a visible minority, speaks the language of those within our community, and as a result, she is able to sometimes connect with our clientele in a way that I can't, being a white female. And a lot of times people won't talk to me because of their own fears and that I don't understand. And the truth is I don't understand because it's not my community. And so I have to be big enough to recognize that even though both of us can do good work, sometimes there's a place where she needs to step in and there's a place where I need to step in. So those are some ways to start working towards becoming a good ally without being a rescuer. Thank you. So I think at this point I'm going to be handing it over to Erin.
Great, thanks so much, Lauren. So we've introduced this concept of allyship that we're talking about today. We've talked about our focus on newcomers, immigrants, and refugees, and I'm going to spend a little bit of time now talking about our third kind of component of our discussion today, and that is gender-based violence. So some of you may work regularly with individuals who have experienced gender-based violence, and for others of you who are listening today, working with gender-based violence survivors may not be the main focus of your work or something that you necessarily have a lot of experience doing. So we're going to start off this afternoon by just taking a look at what we mean by this term gender-based violence. So gender-based violence is commonly used as a sort of umbrella term or a general term to refer to violence that is committed against someone based on their gender identity, expression, or perceived gender. It's important to be aware and helpful to be aware that the terminology and the language used to describe various forms of gender-based violence has evolved over time and continues to shift. So you may hear people using different words in different contexts. So Sometimes people speak specifically about certain forms of gender-based violence, such as domestic or intimate partner violence, physical abuse, sexual violence, femicide, human trafficking, and many more. And we talked a little bit in more detail about that in one of our earlier webinars, which you can always go back and take a look at. Another fundamental point that we kind of want to keep in mind as integral to any definition of gender-based violence is that when we're talking about gender-based violence, we're talking about violence that occurs as a result of us living in these systems in which there exists sort of unequal power relationships, and in which some people have more privilege and power than others, as we've just been talking about. Gender-based violence occurs when that privilege and power is used over others to commit violence, and often to further that power and control. So we might often, when we think about sexual assault or domestic violence or other forms of gender-based violence, we might think of it as something that happens between two people. But in our conversation today, we want to kind of remember that this violence cannot be disconnected from these systems and structures in which people live and through which they have these different levels of power and control. So that's why, in addition to talking about violence that occurs between individuals, we also need to think about gender-based violence as it occurs at the systemic level, or what we might call structural violence, and how these systems and structures such as colonialism, the immigration system, the justice system, and so on can create conditions that make gender-based violence possible. So one of the things that we want to talk about today, as we've said, is what allyship looks like in the specific context of gender-based violence work with immigrants, newcomers, and refugees, and particularly for those working in sort of frontline service provision roles. And so one of the things that I want to start talking about and highlighting are some of the realities and contexts that gender-based violence survivors can encounter when they reach out for help, that can make it really important for there to be supportive people and allies there for them to connect with. Although, we would hope that when someone who's experienced violence reaches out for support or help, they are always offered that support and help. But we know that unfortunately that's not always the case. And there is a lot of research that shows that many survivors do have negative or additionally harmful experiences when they try to seek support. So I want to introduce a couple of these kind of contextual pieces that we can keep in mind when we're trying to kind of make this connection between allyship and gender-based violence work with immigrant, newcomers, and refugees. So one of the first ways that this additional harm can potentially occur when survivors reach out for support is that they're treated as helpless, or for some reason unable to determine what's best for them. And we know, and I'm sure all of you know from your work, that survivors are incredibly strong and resilient and the experts on their own lives. As Lauren spoke about, it can be easy to fall into that kind of problem-solving role and wanting to fix things. But as we're talking about today, being an ally really is about recognizing that expertise that a survivor holds and supporting them in articulating their own needs and learning about, their ideas about how the systems that we're living in can be improved. When we're working specifically with immigrants, refugees, and newcomers whose experiences are unique and distinct, and depending on our own experience and social location, might be very different from our own, it becomes really important then to recognize that experience and knowledge that that person carries with them, and to help them define, what their needs are based on their understanding of their circumstances. Another context that we want to keep in mind is that survivors of gender-based violence are often blamed or questioned for the violence they experience. So this is one of the things that's somewhat unique to gender-based violence as compared to other crimes or other circumstances where people might experience trauma. We know that it's not uncommon for someone who's experienced a sexual assault or who is experiencing intimate partner violence to be blamed for that violence, or at least to be kind of questioned about the truthfulness of their claims. To be asked, you know, what did you do to kind of contribute to that violence? So allyship in this sense really looks like making sure that, you know, you're aware of some of these myths and attitudes that can contribute to victim blaming, that you're able to support survivors who maybe have encountered some of these attitudes and help them, you know, reframe that. And then also, you know, doing the work of challenging others when you hear maybe these attitudes and beliefs being upheld or repeated. We also know that survivors of gender-based violence face distinct barriers when they seek help and support. So no matter what, it can be extremely difficult to reach out for help and support following experiences of gender-based violence. It takes a tremendous amount of courage and can be a very scary thing to do. In addition to being concerned that you know, you might not be believed or you might be questioned, there's a whole bunch of other barriers that exist in terms of sort of navigating some of these systems and accessing supports. So when we're thinking specifically of what these are for immigrants, newcomers, and refugees, these barriers might be related to language. They might be about a fear of how reaching out might impact someone's immigration status, fear about just not knowing what's going to happen, or not knowing where to look for help. So allies, again, can play a really important role in, you know, first of all, being aware that these barriers exist, and then helping to minimize that as much as possible. And that can include not just minimizing them on an individual level, but also thinking about what are the changes that need to happen at the organizational level, at the systems level, so that other survivors do not have to encounter these same barriers. Along the same lines, we also know that, I'm not quite finished that other slide. Along the same lines, we know that survivors have to kind of navigate systems that are often indifferent to the violence they experience. You know, advocates have spent a lot of time and effort making recommendations, advocating for changes, but there's still a lot of work to be done in terms of addressing some of these root causes of gender-based violence, and making sure that these systems, whether it's the criminal justice system, the child welfare system, immigration, social services, are really responsive to the needs of those impacted by gender-based violence. And so connected to that, and as we'll be talking about a bit later in our presentation, when we talk a little bit more about trauma and trauma-informed approaches, we know that gender-based violence carries additional economic, social, psychological, health impacts, and experiencing these impacts can make it really difficult to navigate and reach out for support, especially when these systems themselves are not necessarily always set up to recognize what those challenges are. So allyship, again, in this context is really important because it involves really understanding how gender-based violence can impact someone, normalizing that for them, and then recognizing how some of the systems and supports they need may be difficult to access because of those challenges. And so we'll just go to the next slide. And so, just to kind of recap then, when we're thinking about how we can practice allyship in the specific context of gender-based violence focused work with immigrants, newcomers, and refugees, you know, particularly as frontline service providers, we want to be aware of kind of these general ways that gender-based violence survivors might face challenges in seeking support, but we also want to think about these sort of distinct factors that can make seeking and navigating support more difficult or complicated for immigrants, newcomers, and refugees. So we've got a list of some of these barriers here on the slide. As I just sort of spoke about, being isolated and facing challenges and kind of breaking that isolation because community resources that are out there have not made themselves accessible in a way to immigrants, refugees, and newcomers. In addition to the victim blaming that gender-based violence survivors might encounter for immigrants, refugees, and newcomers, victim blaming can also intersect with racist and xenophobic beliefs and attitudes that can make survivors feel that it's really not safe to reach out for support. Language barriers, economic barriers, fears about what reaching out might mean for immigration status or for one's family in a new community. All of these are additional barriers that we kind of want to be keeping in mind as we are doing this work. And so that in itself is a lot to think about, and I know I've just gone through a lot of information, but of course, as we're all aware, the work that we're doing in providing gender-based violence services, providing settlement services, working at kind of the intersection of both, has been further complicated by the COVID-19 pandemic. And so we again just want to kind of acknowledge that this is a new context that is deeply shaping the experiences of those impacted by gender-based violence and the organizations that support them. On the screen, you'll see reference to a report on a national survey that the Ending Violence Association of Canada and ANOVA, which is an Ontario-based domestic violence and sexual violence organization, conducted over the summer to learn more about the impact of COVID-19 on gender-based violence survivors and service providers. And in this survey, we heard from 376 staff and volunteers across the country who are providing gender-based violence services in a whole variety of settings, including settlement services, about the concerns and challenges that they were facing, the types of changes that they needed to make in their organizations to do their work, but adhere to all these new protocols that we needed to follow, and the impacts that they were witnessing the pandemic have on survivors' experiences of violence and their attempts to seek support. And certainly what we heard is that the pandemic is having a significant impact in all of these areas. And you can read in a lot more detail about the findings from the survey in the report at the link that's there on the slide. And I'll just note for today, specifically in terms of what service providers and volunteers described witnessing in terms of the changes in the experiences of violence that they were hearing about from their clients. And they noted that there was an increase in the prevalence and severity of violence. They noted increased challenges with mental health and well-being as survivors, had to negotiate being more isolated and disconnected from their normal supports. And service providers and volunteers also noted changes in the tactics that were being used to commit violence. So thinking about situations where abusers are really taking advantage of the conditions that have been created by the pandemic to increase violence and control. So whether that's taking advantage of that increased isolation, misusing information about the pandemic to increase control over someone, monitoring or controlling access to technology such as phones and computers, which we know have become so important just to stay connected in general, but also have become a tool that that gender-based violence survivors have used to stay connected to their supports. And so this report kind of gives us a broad look at some of these challenges. And we also know that there's been some really important information gathering and research happening that looks at some of the unique ways COVID-19 has impacted immigrant, newcomer, and refugees and the organizations that serve them specifically. And to speak a little bit more about that, I'm going to turn it over to Margarita.
Thank you, Erin. All right, so while Erin, she just mentioned, Erin and our colleagues in the anti-violence sector, they've been doing the really important work on COVID-19. We at OCASI and in the settlement sector have likewise been witnessing and taking action around the impacts of COVID-19 on immigrant and refugee communities, including survivors of gender-based violence. Over the summer, our national project Building Leadership Capacity to Address Gender-Based Violence Against Non-Status Refugee and Immigrant Women, NSRI Women, a project that brings together multiple organizations and community partners across Canada we hosted a roundtable series to discuss and really try to center the unique experiences and challenges NSRI women are facing in the context of COVID-19. And so what you see here on the screen is a visual summary of our national discussion. These conversations really provided a critical awareness concerning how immigration status, gender, and race, so these kinds of intersectional impacts, inform the experiences of COVID-19 among NSRI women. I think we all know, and we're continuing to hear, a really popular emblem, a slogan in fighting this pandemic has been, "We're all in this together." And this was used really to universalize the experience and urge us also to participate in the measures to help stop the spread of the virus. But what about those people who are not even able to participate in some of the safety measures, right? Staying home or working from home, isolating, social distancing. What are the implications for those who face violence and where home is not a safe option, as Erin's work also highlighted? So we can start to see that the impacts of the pandemic are not universal, and that this was a really important point actually that was raised at our roundtable session, that the impact of this pandemic is really determined by pre-existing dynamics, pre-existing conditions before this crisis. And in the case of gender-based violence against non-status refugee and immigrant women, there was already a crisis. So pre-existing conditions and dynamics, there was already isolation. There was already social distancing among marginalized, racialized immigrant communities in our country. So when people use that slogan, when we're all in this together, as much as it's about a unifying and important idea to keep us safe, it does bring up the issue and makes us think about that it's not necessarily that we're all at the same starting point, and the implications and the impacts will be different. At these roundtables as well, something important is that we heard from speakers that have been advocating, organizing, and championing the work to support and address what was already a concern in a crisis. So they're talking about gaps and accesses to supports and healing for non-status refugee and immigrant women, and they've been working tirelessly and continuously on this. So something that came from there is, can we leverage those voices? Can we highlight the work that's already been happening and being documented? For example, the work of the Barbara Schleifer Commemorative Clinic, the work of the Rights of Non-Status Women Network that's been organizing for nearly 16 years, that have been disrupting this narrative and pushing our mainstream approaches, making us think critically about these issues. And something else I really want to highlight is that at the roundtable, speakers also really emphasized that it's important for us to value the experience. Lived experience is part of our knowledge base and part of our understanding how we should be responding to this crisis, and our planning and our advocacy work. The experience of those who have been living in crisis, it should be valued. It should be viewed as allowing us to make meaning of what is happening and how it also impacts groups directly. And I'm nodding to this idea in saying this, that around survivor-led work, that I think we hear is quite popular. We hear that term, but survivor-led work, how are we really bringing that into even this piece around COVID-19 and understanding our responses to COVID-19? So COVID-19 has brought out the necessity for us to try to think and solve important issues. The social problem of GBV against NSRI women, which was already a crisis. Where in some cases where we're seeing the conditions are the same, but with new fatal manifestations. And there are existing frameworks. There are existing frameworks and groups that have been doing this work, that have been interpreting what has been happening in certain communities. So we should, in this way, what kind of a real important point that came from here is, let's think about those who are impacted the hardest and the least served, because when we do, we're ensuring that we're not leaving anyone behind. So what you're seeing here is the summary, and I welcome people to check out our website, the OCASI GBV website, where you can see other recordings and also other summaries from our roundtable session.
Okay, well, this is the end of part one, so we thought it would be a good time to kind of pause for some reflection. I just want to start by just appreciating how our panelists have really kind of shown the many, many layers of this issue, and how important it is to bring all those layers together, particularly in the context of COVID and all of the tremendous work that settlement and anti-violence sector organizations are doing to bring attention to these issues. So thank you for that. So let's take a moment. We've got a series of reflection questions up for you on the slide, so you can take a moment to think about a time when you may have acted as an ally. What was the most important skill or quality that you brought to that interaction? What did you learn from the experience? You can jot down some notes or take a moment to reflect. If you want to share your reflections, you're welcome to do so with other participants in the chat box or in the chat box. So feel free to do that. If you need to stretch, if you need to grab some water, or do whatever you need to do for self-care as well, pause, feel free to do that. We'll give you about 2 minutes, which is very long in virtual time. So we'll give you about 2 minutes to do that reflection now. Okay, hi everyone. Hopefully you had a moment to pause and integrate some of what we've just been talking about and reflect on your own experience. And I think we're going to keep moving, so let's move on to part 2. Great. So we're now going to delve a little deeper. So we're going to talk about approaches to allyship with newcomers, immigrants, and refugees, particularly in terms of our role as service providers, right? So whether we work in settlement, anti-violence organizations, or wherever we're situated, we really are in a unique position to act as allies. And so that means that we can take action in part by learning about some of the most promising approaches, some of the most important systemic approaches to understanding the issues of GBV as it affects these communities, and doing that kind of legwork. So just a heads up that many of the slides are going to be purposefully information heavy. So don't feel like you need to read everything that's on the screen. You will get a copy of the slides for your reference, and our panelists are going to do a high level signaling of what's particularly important to focus on as we go through. So I'll turn it over to Margarita, who's going to introduce the approaches that we're going to be covering today.
I'm muted, sorry. Thanks, Selena. All right, so in webinar 1 and 2, we introduced some foundational concepts, some approaches that some of you may have been familiar with, especially when you're working issues of GBV and when you're working with immigrants and refugees. Today, we kind of want to circle back and talk about how they relate to allyship. And it's a way of being in the work that's informed by these approaches. And as Lena mentioned earlier, there is a lot of text in some of these slides, but we have information included and other references that you can follow up and do your own type of reading as well. So I'm going to talk to you about anti-oppression, anti-racism, and intersectional approaches to doing our work. And some of you may have heard of those terms, and increasingly these terms are becoming popular, but sometimes they still remain really vague. And what I will do is I will start as a starting point. I'm going to separate some of these ideas of anti-oppression and anti-racism in an effort to really distinguish them. And then I'm going to emphasize an intersectional approach, and that's helpful for us to bring the ideas together, for us to be able to understand how they interact. And then Lauren's going to speak to trauma and violence informed allyship, and allyship that is guided by cultural humility and safety. All right, so let's start with anti-oppression. But before that, when we're talking about oppression, we're talking about the use of power. So the overall organization and use of power in our society. Oppression is the use of power to disempower people, to marginalize, to silence, to subordinate social groups. And it's really helpful for us to think about the different contexts where oppression or this use of power operates. So it can be at a structural level, so we can think of laws, we can think of policies. It can happen at a disciplinary level, so we're thinking about bureaucracy, management of resources. It's in the language that we use, the images that we see and that we consume, and it's also happening at an interpersonal level on the everyday kind of scale. But what's really important to capture in all of this is that we're identifying the use of power and oppression happening through systems. So systems of oppression. We've got racism, sexism, social class, ethnicity, nation, and others. It's really built into our world. It organizes our world. These are things that don't just turn on and off, which is why it really requires a critical lens and a commitment when we think of anti-oppression, a commitment so that as service providers and people working within these systems, sometimes as extensions of these systems, right? So that when we are working in those spaces, we can see the gaps. We can identify injustices, we can see where are the barriers, so we can humanize a system. So little steps, right? When we're talking about anti-oppression, it's a lens, it's a way of being attentive to connecting these dots, right? Connecting the dots between what's happening at a personal level to social systems, right? So understanding that it's built into our system and understanding that means it limits people's life chances and opportunities. So recognizing the role of this, the impact of it. Could we move on to the next slide, please? All right, so what does anti-oppressive allyship look like in practice? There are many ways that we can really integrate such an approach in our everyday practice. And one way is to learn about these systems that may not be relevant to us personally. For example, some of us might have been born in Canada and never really thought about what it's like exactly to be a migrant here, or what it is like to be a contemporary migrant here who may have precarious immigration status, to live with an immigration status that's insecure. So when we think of allyship, it's an active practice. There's learning, there's unlearning, there's reevaluating, wanting to do the work in solidarity, to show up and show our support and commitment, in this case, towards anti-oppression. So in our anti-oppressive work as allies, we do need to invest time in learning about the immigration system and thinking critically about immigration status, especially in this context, right? I'm referring to the context and the work that we're doing here and that we're speaking to. So thinking about immigration status, that means we're thinking about pathways that are available to immigrants that can expose people to challenges and vulnerabilities. So these pathways, when we think about the different kinds of, it could be a temporary status, permanent status, we have precarious status. This is going to determine access to support, eligibility to programs. It's developing a relationship also. This kind of status can develop a relationship where people are dependent on certain systems. It limits their movement. It limits the options and access they might have to work. It can also mean and translate into separation from family while people are migrating here, waiting, sponsorship, etc. And what's so important is just let's think about how this immigration system, it's the initial contact, it's a relationship to Canada, right? So this is a primary system, which is really determining and shaping people's lives in a profound way. So when we think of anti-oppressive practice and in allyship in practice, maybe we're not talking necessarily in that moment to change the law when we're working with a client right in that moment, but it is about thinking about these little gaps. It's having a lens on to think about how is immigration status implicating the client that I'm working with. Next, I want to focus on another system of oppression, racism. So there we go. Awesome, thank you. So this is us now focusing on another system of oppression, racism. The reality is that we live in a system that is racist. Our foundations, we are part of a white settler colonial society. It organizes our world and our relationships. And at the same time, as members of part of this system, what it also does is it socializes us not to see racism. We sometimes just think that racism is happening when someone at a personal level is doing something that's labeled, that we've already determined is racist. But the thing is, and what I really appreciate about some advocates and scholars who've talked about racism and really trying to emphasize the idea of it being systemic, is they say, we're not actually, our job really isn't to walk out into the world and call out everyone who is a racist. That would be really exhausting. Our work is to focus on the systems that produce this racism. So we're thinking about the ways in which our world is organized, the barriers to resources, and race is one way in which those barriers are enacted, is one way in which that is determined. So living in this kind of social world that produces these ideas means we're sometimes without knowing, and this is a really important part, without knowing, it can be kind of this taken for granted. We're sometimes upholding the status quo or this kind of racist reality. And something that I really want to emphasize here and how this kind of drives home the point is that not every person in our society must hold racist beliefs or engage in individual acts of racism for racism to exist and to continue in our society. Because what we're referring to here is how racism is systemic. It's a system of oppression. It's a power structure. It's maintained through systems and practices. And if we break it down further, when we're talking about this power, okay, give me examples. When we're talking about oppression and we're talking about racism, it means it's going to determine who gets access to resources, who's getting excluded, whose lives matter, whose lives are disposable, whose lives are less grievable. So if we have this kind of reality in mind, we start to see how this comes to life, right? And therefore, anti-racism, it really is about an active role in challenging that systemic racism. It means that we can first understand, build that awareness around what is this racial order, how is it being imposed, and that awareness can then also lead for us to examine imbalances of power, right, that are existing. And so some people might, from our previous webinars as well, I'm kind of winking here at the importance of history, right? And this kind of history, but also understanding the ongoing implications of this kind of racial order that exists. And the importance to really understand that to make sense of present day reality. So becoming an anti-racist really involves developing this kind of like historical analysis, and this historical lens, using that to make sure that we can be familiar with some of the ways in which it manifests in the current day, so that we can avoid minimizing or deflecting or denying that racism persists and that it happens on a daily basis. So if we go into the next slide, what does anti-racism and anti-racist allyship look like in practice? And remember how Lauren pointed out earlier, this is really an ongoing process. It's sometimes uncomfortable, and it requires that we unpack our own power and privilege in relation to others. So if we ground our thinking in the context of gender-based violence against immigrant and refugee women, what's the role of racism? So perhaps GBV impacts all communities, because we hear that often. It impacts all communities. But what we also know is that it impacts communities in different ways. What if we're a part of a racialized community? It's going to shape our experience of violence. It's going to impact our ability to access support and healing. So applying an anti-racist approach to allyship then really means recognizing that many immigrant and refugee women's experience of violence and gender inequality are connected also to their experiences of racism. We should be prepared to hold space for those experiences. We can help advocate for ending racism and xenophobia, and we can take steps to ensure that the services we provide are not reinforcing stereotypes or participating in racial bias or exclusion. So when we think of GBV, we can understand that gender oppression and understanding gender helps us understand the violence they experience. But then, for example, understanding economic vulnerability and precarious immigration status, for example, that brings up other issues of race. All right, so I'm going to move on to the next slide. And now I'm going to speak to intersectionality. So I did want to kind of separate these ideas like oppression, talk about anti-racism, talk about racism as one system of oppression. And now I want to talk to intersectionality to kind of focus on how they interact. Now there's a lot at stake when you're trying to speak to intersectionality in one or two slides. Intersectionality has been powerfully articulated by Black feminists, and intersectionality emerges. These ideas of intersectionality, they emerge during massive social changes that were prompted by critical ideas and actions. And I really like to stress that our current understanding of intersectionality really needs to embrace that legacy and develop critical tools that can help us, intersectionality can help us really develop critical tools to deal with the challenges of our time. And also understanding that when we talk about intersectionality, we're talking about a concept that is much broader and includes a lot of different interpretations and a lot of different ways in which it's implemented in practice. So we really have yet to fully understand the potential of the ideas of intersectionality as a tool for change. But something important that I want to highlight here is that we are human beings that are multidimensional. We occupy many different social locations and are perceived as members of many different social groups. Social identities is important here. This has implications for the ways in which we relate to the world and the way that the world receives and responds to us. So of course, this means that we have different experiences of violence. More than a difference in the expression or manifestation of violence, what we also know is that it implicates access to supports and healing of violence. It'll be implicated by the interaction of different social locations and identities. So in cases where race, gender, sexual identity, and immigration status are working together to limit access to social services and supports, that's why we can understand the importance of grounding our understanding of the violence through an intersectional lens. Intersectionality really allows us to be sensitive to these multiple systems at play and to understand what's upholding violence, right? And what's making it difficult for groups to access services and support. So if we move on to the next slide, intersectional allyship in practice. And I just want to say a really important resource that's listed here on the slide is developed by Kimberly Crenshaw, and it's a primer on intersectionality, and she refers to intersectional allyship. So I really encourage you to take a read. It's a great resource. But what does intersectional allyship look like in practice? So what I'm really trying to stress here is that the social problems that we are referring to, sorry, one second. The social problems that we are referring to are not able to be boxed up and understood by only thinking about gender. So we have to think about other different systems that are at play and that are interacting. And what we see, and I want to give you just an example of some of the work that we're doing at OCASI, is that what we see is in our work at OCASI is that the way that violence against women intersects with racism and immigration status is very important. This is that intersection that we're focusing on. So then the reality is not that because of an immigration status, people suffer violence, but understanding that how that immigration status can shape the experience of violence and then hinder and create barriers for people to access safe services and support. Being an intersectional ally in this sense also means pushing our understanding and broadening our understanding of GBV. So if our approach is intersectional, then what we're trying to do is we're trying to think of issues from an intersectional level. We're trying to think of what can be the broadest articulation of the problem that would allow to include the interests and the needs of a broader community. And sometimes this impacts the way we do our work, of course. It really impacts the way that we do our work and what we think our options are. So for example, and we're seeing this more and more, we're learning that the police are not always a safe option for racialized immigrant women. So we're learning that there might be fear in terms of calling the police, to give you an example. So sometimes some of our advocacy work that we're doing needs to be alert to this, right? When we universalize a problem, when we create a universal plan, sometimes that's leaving people out because we might not be thinking about some of those other issues that come in when we consider race or when we consider immigration status. So what intersectionality is really encouraging us to do is let's think about those who are impacted the hardest, maybe the least served, and that our response efforts can really do be able to kind of include at a more broader sense these issues. So just to leave this kind of here, is what if our benchmark, right? What if our starting point was supporting women, for example, without status, non-status? Wouldn't that we would be kind of training some sort of second nature, so we'd be equipped to deal with and provide supports to women without status, and ultimately then we'd be able to be considerate of other needs as well. So when in Kimberly Crenshaw's primer, and I do encourage you to read it, she really refers to our allyship sometimes can be limited because we're just thinking in our lanes. We're thinking about gender, we're thinking about race, so she's really encouraging us to think, no, let's think about what happens when there is work that we want to do where we're considering these intersections so we don't miss any harm. So we're asking ourselves a lot of questions when we're doing this work. And I just want to say as well that the complexity of GBV, because this is a lot to think about against non-status refugee and immigrant women, that's definitely, we hear this all the time, it's very complex. But we can also not have to see this as a liability, but as a strength, as a way to strengthen our efforts and our work in both the anti-violence sector and in the settlement sector. A way of seeing that if we're centering the needs of those who are most vulnerable, and if we're considering these kind of social and systemic contexts, then we are truly thinking about everyone. So next, I'm going to pass it to Lauren, who's going to introduce the last two key approaches.
Great, thank you, Margarita. So I'm going to have a conversation about the last two approaches, and the first one is around trauma and violence-informed approaches. So a trauma-informed practitioner or worker relies on their knowledge about trauma to respond to clients in a way that conveys respect and compassion, honors self-determination, and facilitates the rebuilding of healthy interpersonal skills and coping strategies. Regardless of whether a client is seeking services to address past trauma, a trauma-informed practitioner views any presenting problem in the context of the client's traumatic experience. So this does not mean that we need to know details of their traumatic experience, What this means is that a trauma-informed practitioner conceptualizes and understands negative behavior as coping strategies, which were at one point adaptive or helpful in a traumatic environment. However, these behaviors have now become self-destructive or harmful to the client's functioning. And so by viewing the collective experience of the individual in this holistic way, clients' behaviors that may seem irrational are reconceptualized as a survival skill. And that once at some point helped individuals respond to threatening encounters. So the key point here is, instead of asking what's wrong with you, asking what happened to you, and understanding that in all of our interactions with our clients. What is key is never to assume you understand or know about an individual's trauma. What is traumatic for one person may not be traumatic for somebody else. So never assume because you know someone's migration status that you know the trauma that they have experienced. So we can move to the next slide. When it comes to immigrants, refugees, there is a paradigm that was created to describe sort of the process and the trauma that is experienced during the migration process. This was originally developed for refugees and asylum seekers. However, it can be applied to anyone that's going through the process of migration. So there's trauma that typically occurs during the pre-flight period. This can be disruptions, secrecy, fear, traumatic events, things like natural disasters, those types of things that can cause people to consider migrating or leaving their base, their home base. This can also be experiences such as the loss of a parent, loss of a pet. Those types of things can be traumatic, and so it can have no relation to the reason why someone may have chosen to immigrate, but recognizing that people have experiences prior to their migration to Canada that may be impacting them and the way that they're operating at this point in time. During the flight period, there's also traumatic experiences that can occur. This can be food insecurity, separation, lack of trust, experiences in refugee camps, those types of things. There's also just the fear of leaving home, being away from your family, making that big decision, missing family members, those types of things, missing your culture, your school, those things can all have a traumatic impact on individuals, again, regardless of the reason that people are choosing to migrate. Finally, the resettlement period. There is a period during that resettlement period that can be very traumatic for individuals. So cultural isolation, loss of status, limited social supports. And again, this can happen regardless of the reason for migration, whether that has to do with refugee, business status, whatever it may be. And so just acknowledging that these different levels and different experiences of trauma can all compound together and can make it very difficult for individuals that are struggling. And a lot of this too can create the perfect storm for gender-based violence, particularly when it comes to things like isolation. And this is even heightened now even further with COVID. So trauma-informed practitioners attempt to encourage clients to develop a sense of control over their own recovery process and foster opportunities for clients to make their own decisions. Many individuals choose to stay within abusive relationships. Sometimes service user feels that it is their safest option given the nature of their abuser's threats and the reality of the legal protection that may be available to them. This is further complicated with individuals that have things like precarious status or their migration status is used in a threat. If you leave, I'm going to pull you, I'm not going to sponsor you anymore. Those types of things have all been utilized. While as caregivers and helpers, we really want people to no longer be in situations that are dangerous or frightening, but ultimately we cannot make that decision for them. That is ultimately the decision that lands with the individual. As long as there are no clients at risk or no children at risk, then two adults are free to make that choice. And as an ally, a trauma-informed ally, you need to recognize that that is a reality and that if they're not ready to leave at this point, it doesn't mean they won't be later, but also to support them in recognizing that individuals often have many different ways that they protect themselves in domestic violence situations or gender-based violence situations. And so to really work on developing those and what people are already doing to keep themselves safe. And Yeah, so a good ally here recognizes the ways in which an individual has survived and encourage those. Pay attention to your process of your intake process and things of that nature, what you have in your office, what may be threatening for individuals, where people are seated in your office, making sure that people feel safe and not triggered in any way. If you're ever concerned about an individual facing gender-based violence, do not assume that the perpetrator is male. This can isolate members of the LGBTQ community. And so just because someone comes in with perhaps female, do not assume that that female is just a support person. That female could very well be the abuser. So if you're concerned and you want to speak to your clientele, do it in a way that's only you and the clientele, regardless of who they bring as a support person. And continue to enhance any safety and choices that the client continues to make. So we'll move to the next slide. Cultural humility and cultural safety is the last approach that we're going to talk about today. Cultural humility is a lifelong process of self-reflection and self-critique, whereby an individual not only learns about another individual's culture, but starts with examining their own cultural beliefs and identity. So, and this is a key part when it comes to being an ally, is recognizing our own identity and who that is in a context of power and privilege and where that stands. Privilege is not a ranking system. I really like to highlight that. It is not a ranking system. It's about different arenas, and in different arenas, individuals will have more or less power based on what is going on around that. So a big part of practicing in a culturally humility way, in a culturally humble way, that's a better way of saying that. A big part of this is to recognize your own cultural identity and how this relates to power and privilege and your work. So how are you shaped by your cultural identity? There are many different facets to individuals' cultural identity beyond sort of the appearance of race, and to understand what that is and how that's interacting within your own self and within your clients. One question to ask yourself is, who would you be if racism or systems of oppression did not exist? Would we still be doing the work that we're doing? What does that mean for who we are? Really looking at that. And do you hold any beliefs about gender-based violence being more prevalent in a particular culture? Where and how did you develop those beliefs, right? This is the uncomfortable part, and really sitting in that and understanding what that is. Cultural safety is slightly different. That is around having an environment that allows and encourages people to practice in a culturally safe way. So having prayer space can be one way of acting as a cultural ally, cultural safety ally. Looking through your intake questions and what are you asking people when they first come into your building, those types of things are all ways of doing that. The art that you're putting up, could that be art from various cultures? Who is the artist? Right, see what type of messages you're conveying. But that's sort of the difference there. But really the big step is looking at your own culture and what that means for you, and then moving forward to what that means to your work and what that means to your interactions with your clients. Perfect. So I'll pass this back over to Selena.
Awesome. Thank you so much, Lauren, and all the panelists for introducing those concepts and walking us through what that looks like when we're thinking about allyship. Thank you also to the participants that have been sending your questions and comments and feedback. We really appreciate it. Some really good insights that folks are sharing. So thank you for that. I'm going to keep us moving just in the interest of time. So a little bit of a pause just to think about, we've covered a lot of material, maybe try to think of one way that you might apply one of these approaches in your own work moving forward. So take a little bit of a breath, reflect back on that. Let's give us maybe another 15 seconds to do that or so. Wonderful. And we'll turn now to part 3. So in this part, we've really pulled together what I like to think of as an offering. So what are some more practical, concrete things that you might be able to implement in your own service provision practice that we feel align with many of the approaches that we've talked about. We've tried to organize it by like the areas where you might engage with allyship. So in your work with clients, within your organizations, and then in terms of your own personal learning and self-reflection. And so I'll hand it over to Catherine.
Thank you, Selena. So this section, we have probably almost 15 minutes left. So this section is really kind of a brainstorm. And in our organization here in Halifax, YMCA Immigrant Services, there's a very culturally diverse staff team. So we often get together in different groups for various meetings and talk about the work that we do. And it's really like, as a white Canadian person, you know, growing up here in Nova Scotia, I really appreciate the diverse experiences of my colleagues. So it's been a real joy to learn about different cultures. And we do the school settlement program. So we do a lot of activities with children about different cultural celebrations, different values and beliefs, different ways of looking at things. So if you have an opportunity to brainstorm in your organization about your work with newcomers, immigrants, and refugees, and how to apply some of the principles and approaches that we introduced today, that's really the purpose of this section, to give you some ideas around that. So again, the slides are a little text heavy. We're going to give it to you as a little package, a booklet. So as service providers, one of the main areas where we can practice allyship is in our interaction with clients. And we know that everyone in this webinar interacts with clients. I think somebody had questions about how to introduce GBV topics. So we did a workshop, a variety of workshops, information orientation sessions around healthy families, communication, resources available in the community that people can access. And some ways to communicate are here on the slide. So to focus on the strengths of clients, their resilience, what they bring with them, and also their interests, what kinds of things they want to know about. So helping clients identify their strengths, sharing and modeling skills for recognizing feelings, supportive communication. Often when we do workshops here, we have teams of staff facilitating together. We want to communicate non-judgmentally and create emotionally and physically safe environments for the staff that work in the organization, then also for the clients that we serve. There's a few examples of phrases that can help us with that on the side there. So there's some other ways to identify allyship here when working with clients. And to recognize that personal and social problems are linked to the social and economic structures of society. That's what we've mentioned, sort of the thread throughout. So we want to adapt resources and information about services to make them accessible to our clients, make sure they understand the context of them, and then also if they need language support to access that for them. Believe survivors when they disclose experiences of violence. Collect feedback from service users about their experiences, learn about crisis and settlement services in our communities to be able to make referrals. And then if we're concerned that someone is experiencing abuse in the context of a settlement organization, is sort of what I'm talking about, then we want to make sure to make a separate meeting with them and follow up, respecting their privacy, and also trying to give them the resources that they need. In the webinar, one of the webinars in May, we talked a lot about risk assessment and how when people leave an abusive relationship, it can be very dangerous, and that some people don't want to leave. So safety planning has to be for staying and for leaving. And we want to offer practical help to clients so that they can access our services. And I gave some examples here: bus tickets, childcare, healthy snacks, drop-in programs that are flexible and open, and workshops, as I mentioned, around healthy relationships, accessing supports and services. We did one about healthy families, and we talked about different laws and different services available in our community. So within our organizations, we can participate in GBV prevention efforts going on in the community. promote policies that support the well-being and safety of survivors, invite guest speakers, consider barriers to accessing services, recognize and accommodate cultural and religious needs. There's a good article here from Nisa Holmes that explains different ways to be flexible in our service delivery to accommodate diversity. Include intersectional policies and organizational structures and form partnerships with other organizations. So our partnership group today is really getting to know each other and learning from each other in this project that we're working on together. So we focused on ways to practice allyship and interactions with our clients, but another way that we might want to think about it is how we can be better allies within our organization. So here's some examples here. And with regards to personal growth and self-reflection, learning about the history of Canada and diversity in Canada, in your community and nationally, is a good way to recognize privilege and to understand different groups' experiences and to be sensitive to that. So the other thing to do is listen and learn. I think that was mentioned earlier. Speak up, not over. It's important to ask for consent when we want to try to offer our allyship or our help to someone. Make sure they want our help. Acknowledge mistakes. If we make a mistake, it's a very complex area. Apologize, commit to change and moving forward. And allyship is action-oriented. So it's following up with consistent and reliable actions. We like to say that we walk our talk. When we say we're going to do something, we make sure to do it. So to wrap up here, we have 2 other webinars in this series in November and December, inviting a few guest speakers to come and join us for those. So you're welcome to join us. It would be great to have some people participating. And we do have project updates and resources and discussion at our staff network on GBV. That's the name of the group on the settlenet.org platform. And so there's resources here that you'll receive as part of this package, and some different ones there that you can see. So today we've covered the foundations of allyship. We started by defining key terms. We talked about how effective allyship is anti-oppressive, anti-racist, intersectional, trauma-informed, and practiced with cultural humility. And then we close with some tips on how to practice allyship and your relationships with clients within your organizations, and ultimately with our own personal growth and self-awareness. So I hope that you enjoyed the presentation, and at the end of today, we'll be sending you a feedback survey. And in the feedback survey, you can comment on what you thought of the information presented today, and also what other information you might be interested in receiving from this project. And so I think that wraps it up. Maybe we'll all come together here.
We've had a lot of great comments. Some people have had to sign off, but they've sent their tremendous thanks. For anyone that doesn't receive the copy of the slides for any reason, you can email Catherine, right?
Yes.
And we've had some great comments. One person is looking for a term to use other than victim or survivor to recognize strength and resilience. I thought that was interesting. Put that out there in case people have ideas about what other terminology we might be able to use, and we can continue that discussion on SettleNet perhaps.
I know my coworker utilizes the term participant
Okay.
to define her clients, regardless of their experience. So she'll just refer to my participant or the participant if we can't use their name for privacy purposes.
Yeah, excellent. Yeah, and that person responded saying that they'll sometimes refer to it as someone with lived experience. But yeah. Awesome.
Great. Well, if there's no other questions, then we'll wrap up there.
Check. People want to learn more about cultural humility and culturally safe approaches. So that might be something we want to bring into a future training. So that just came through. Yeah, lots of appreciation, which we always appreciate because there's a lot of work that goes in behind the scenes. So thank you for also sharing your appreciation as well. And one person wants to learn more about private sponsorship and what people go through when they're being sponsored and how that might relate to GBV.
I'd strongly encourage looking at that. We hear a number of people who will have their sponsorship threatened as part of violence and control, even though legally that's not what can happen and you can't be deported if you leave an abusive relationship, but I'm sure we can talk about doing more on that, but also do look into it if you're able to.
Yeah, I'm part of a private sponsorship group. Like sometimes community groups sponsor a person who's a refugee. So I could speak to that a little bit if you want to email me.
And I might just plug in the courses at OCASI that focus on gender-based violence against immigrant and refugee communities. There's a few, they're self-directed, and they really kind of walk you through what are the impacts of immigration status on, in the case of GBV, and some of these things that you're mentioning, give you kind of case examples. So you can also check out our website. With the OCASI website lists some of those courses, and I know there's a few that are available right now, and they're self-directed.
Wonderful.
Excellent.
Great. I think that brings us to the time, Catherine. I don't know if you...
Okay, yes. Well, thank you again, everyone. Thanks so much to the working group, the panelists. I always learn from you when we do these presentations. So thank you so much.
Thank you, Claudine, as well.
Right. Have a lovely rest of the day.
Yeah.
All right, bye, everybody. Thank you.
Thanks.